Psychiatrists can't keep propping up a broken mental health system.
I don't want to leave my job, but I don't know if I have an option.
People are going to die because the public mental health system is all a lot of people have.
But from tomorrow, that public health system is set to lose half of its psychiatrists amid a long-running dispute with the New South Wales government over low pay and chronic understaffing.
About a third of our staff have left. When patients come to our services, they're so full that we're needing to turn away patients, even people with really severe mental illness, because there just isn't capacity to see people. In some community teams, we have a single psychiatrist who might be covering hundreds of patients. And when you consider how unwell these patients are, how much care they need, it's really unsustainable.
From your view, is that safe for patients?
I don't think so.
203 of the state's 295 staff specialist psychiatrists intend to resign. They want a 25% pay increase to help attract and retain doctors, a request the state government is flat out refusing.
We can't afford wage increases akin to around $90,000 or 25% for some of the highest paid healthcare workers in our profession and right across the system.
So how much are psychiatrists being paid currently on average?
A psychiatrist that starts in New South Wales would get about $260,000, which I appreciate compared to an average income that is very high. But if you can earn 30% more in another state, then, you know, when we're operating under a national shortage, then you're going to lose staff.
Do you think there's much sympathy for very high-paid doctors saying we want 25% pay rises?
I think that there is a lot of support for psychiatrists who are actually putting their own jobs on the line to try and shed some light on this issue and to try and find solutions to bring staff back and to improve our mental health system.
Psychiatrists say resigning en masse is less about pay and more about patient safety.
Dina, you've handed in your resignation.
Yes.
How difficult was it to make that decision?
Probably one of the most difficult decisions I've had to make in my entire life because of my concern about my patients and the job I love.
Child and adolescent psychiatrist Dina Mahmood says the under-resourced system is having lifelong consequences for young patients.
Coming in and then get turned to a service that doesn't receive them quick enough or doesn't provide a service long enough or intensive enough.
Riley knows what that's like. They've been admitted to mental health wards roughly 20 times since the age of 13.
At one point, my acute unit had a new psychiatrist every week. And so you basically had to keep telling your story and they'd get a treatment plan together, but it wouldn't continue. They did eventually get a permanent psychiatrist, but it had just taken so long and I'd just kind of given up.
17-year-old Riley is a survivor of significant childhood trauma and has been diagnosed with numerous mental illnesses, including depression, anxiety, and an eating disorder. They say finally receiving consistent care at a long-term mental health unit for young people has saved their life.
I'm in recovery. It's still a long way to go, but you know, I've restarted school. I've found things I enjoy. I'm living outside of hospital, and that's something I didn't think was possible.
But they fear lives will be lost if the mass resignations do happen.
It makes me so sad because it's my friends, people I've met, people I don't even know that it's going to be impacting, but I know they deserve a chance of recovery. And without psychiatrists to head the ward, it won't happen. It would take away people's hope. And without hope, there's nothing in life.
Given the acute nature of the condition that some of these people are in, is it then responsible, do you think, for psychiatrists to resign en masse? Because it will impact the patients.
We work in mental health because we care about our patients. And if you're working in a system that actually doesn't allow you to provide that care, then sometimes it feels like you're doing more harm than good. I understand that 200 people leaving, the outcomes would be catastrophic, but for individuals that are trying to access our mental health services at the moment, the outcomes are also catastrophic for them.
I wish I don't have to. The conditions have been there for a long time, and patient safety are compromised. We are failing. The system is failing.
Health officials say contingency measures are being put in place, but warn the mass exodus will have huge knock-on effects for other services.
Despite the plans that we have in place, it is very difficult to overnight replace 200 psychiatrists. It is very difficult for us to fulfil the critical work that they perform.
Don't do this to patients, don't do this to the healthcare system that I know you love and support.
We have been speaking to the government for 15 months saying our systems and our services are threadbare. They are abandoning patients, the mental health sector and us.
What's the likelihood you'll be in your job this time next week?
Nothing is resolved with the government, then I'm not going to be in my job.
How does that feel as someone so committed to their patients?
No worries. It's sad. Not what I would have planned for my career or for my life.
God, this is an impossible situation, isn't it? And unfortunately, when people hear figures like those kind of salaries, they think, well, like, get what you get and don't get upset, you know, because it's a big amount of money. But ultimately, those people, we can't have no support for those people because they're supporting people and it is intense, that job to do. And if you can't do it and you're threadbare, you're not going to be supporting those people in a way that they need support either. So it's a really hard spot.
One of the challenges I found in putting this story together is that this is a corner of society, our world, that you can't actually see inside.
Yes.
Yeah.
So you have to take the word of those people that are working there, right? I mean, it was pretty striking to me to see one of these leading psychiatrists in tears saying, clearly incredibly committed professional that cares very deeply about these people that are vulnerable. But I can't understand how it gets to this point where, you know, professionals and governments are at such loggerheads, you get a mass walkout. It doesn't seem right. You can read the statement that we've got from the New South Wales Government. It's on our website.
And, of course, crisis support is available 24/7 through Lifeline on 13 11 14.